Hello and welcome to the third edition of the Texas Dental Association Committee for the New Dentist podcast. My name is Dr. Joshua Austin and I will be hosting today's show. Recently I had a special opportunity to interview the ADA president, Dr. John Findley. Dr. Findley is a native Texan, a member of the Texas Dental Association, and practices in Plano. Dr. Findley has been a great leader and has represented Texas very well during his time in leadership. The interview took place at the ADA Washington Leadership Conference, which gives practicing dentists an opportunity to become part of the political process by meeting with their congressional representatives. Without further ado, my interview with Dr. John Findley. We are here with Dr. John Findley, President of the American Dental Association, resident of Texas, practicing from Plano, Texas. Dr. Findley, thank you for joining us today on the Committee for the New Dentist podcast. I just wanted to ask you a few questions. As you come to about the halfway point of your term as President of the American Dental Association, what are some of your experiences been over the past 6 months serving as President?
Well, Josh, thanks for the opportunity to answer a question like that. That's almost a free question because it's been a tremendous experience for me. I can tell you it's been work. I can tell you it's been exciting. I can tell you that around every corner there's been something new and something different. I'll get through this year and leave office saying what a wonderful profession we have, how the future, I believe, in spite of the change, or maybe even because of the change, how I feel like the future is very bright for the profession of dentistry. So, a good experience, been a lot of work, a lot of things to do, and much change. But I'll leave very excited about the work we've done and the promise that the future holds.
Excellent. It seems like it's been an extremely challenging time recently. Where did you get your start in organized dentistry?
Interestingly enough, I was, as I like to say and still very fondly say, I was just a Plano dentist. And I saw things that were happening in the profession that nobody seemed to be aware of and that people weren't doing anything about, particularly as related to governmental affairs, regulation, licensing. And I complained very loudly. Now, I was always a member. It used to be that you graduated from dental school and membership in organized dentistry was assumed. So, as assumed, I joined dentistry, but was very inactive. And as I realized these things weren't being done and complaining very loudly about how ineffective and how nobody was doing any work in organized dentistry, I realized that the person I was talking to was me. And at that point, I became involved, and I started working in organized dentistry because the realization of two huge ideas. One, you don't have any right to complain if you're not involved. And two, that we can choose to be the masters of our own fate. And when you realize those two things, it almost is compelling. You have no choice. You have to be involved. And once you're involved and see that you can affect that change, it sticks with you. And I never started out, never intended to be, who would have guessed I'd have been president of the American Dental Association. Never thought about being president of the Texas Dental Association, but the idea of being able to change your profession and to secure your profession, to make the profession better for the practicing dentist and better for our patients, literally can consume you. And as I look back now, that involvement and that all the effort and work I've done and gone through on behalf of organized dentistry has been well worth it.
Excellent. I think that's good advice and a good point of jumping off for new dentists as far as looking at getting involved and seeing how far organized dentistry can actually take somebody. Where do you feel like we stand today? Do you feel like we stand in a strong position as far as dentistry goes in our position with the lobbyists? We're here at the Washington Leadership Conference for the ADA, and we've spent the last couple of days up on Capitol Hill and meeting with congressmen and senators. And where do you feel like we stand? Are we in a strong position, stronger than in the past, or weaker in the past? And where do we go moving forward?
Well, I guess I have a couple of areas to comment on there. First of all, I have to say that the younger professional, the new dentist, if you will, has brought such a new dynamic to the profession. I think that we have given you an opportunity. I think we've brought organization and political affairs, especially in Texas, especially here in Washington, but I think we've brought a new organization that dentistry never had before. If the younger dentist can take this organization that we've brought up and brought to this point, if the younger dentist can take that and can build on the foundation that we've left, the profession of dentistry in the total healthcare environment will not just be as an observer. You'll be defining the scope of this profession. Every facet of this profession will have more input from the practicing dentist than in the past. So I think we've gotten a good start. I think the characteristics of our profession lend us to being on the right side of issues, but there's a lot of work to be done, and that foundation, that base, that vehicle that we've got going now really needs nurturing, it needs care, it needs your participation. And I can tell you that there are new dentists out there. There are even dentists who've been practicing a long time that say politics is not my game. I don't want to be involved in that. Well, you're involved in politics whether you like it or not. And the future of dentistry, the future of your dental practice, the future of what you do in your individual treatment room is related directly to how successful we are in Austin or in Washington. So you've got an opportunity. And you know, if I look at one thing, if I had just one thing to look at and wish for the future, it's that the new dentists, the younger guys in the profession, take what we have, take what we're offering, and do exactly what I think you'll do. Make it a better world to live in, a better world to practice in, a better profession to work in. I think that opportunity is there, Josh, and I think that the opportunities afforded for the new dentist would have been unbelievable 20 years ago, but it's there now.
Excellent. Now, where do you recommend for a new dentist who maybe is not involved so far? Where would you say is a good point for them to get involved? How would you recommend going about that?
Well, you find somebody, you know, it's so true that the best thing that you can do is get involved at the local level. Go find someone in your local dental society. Say, take me to the meeting, let me be involved, tell me what you know about it. Become involved at that local level and talk to your own peers and establish that base of not just practice, but the base of working with your fellow dentists in the area. Get that established and then expand your horizons. It takes time to learn the system, if you will. It takes more time to effect change, but that all begins at your professional, if you will, home. We talk about dental home, but your professional home should be your professional association. So becoming involved. And again, I want to stress that I think that the new dentist, the younger dentist today will find that you not only are welcome, the experience is that you're needed. You're a vital part of what we are and a vital part of what we need to be. So feel like that you can go into those areas and participate and contribute.